One look, one heart. Let's get together and feel alright.
Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about mental health well-being as we observe World Mental Health Day on October 10th, 2023. Today I will be joined by Dr. Mark Constantine, attached to the Ministry of Health Mental Health Unit. Welcome to the program, Dr. Constantine.
Thank you for having me, Ms. Martin.
So World Mental Health Day is observed on the 10th of October yearly, and this year we look forward to it because it's a time where we're able to spread awareness on mental health issues and concerns. Let's begin by talking a little bit about the mental health unit, what you guys do down there, and how the unit functions on a daily basis.
All right. I should say that's a very simple question to answer. The mental health unit is a unit that falls under the purview of the Ministry of Health. The mandate of the mental health unit is, of course, to provide general mental health services to the general public. We are located at 252 Commonwealth Street. A lot of people still don't know where that is. It's between Camp and Thomas Street, behind the Ministry of Amerindian Affairs. And what I can tell you is that the mental health unit, though we are located at that address, and persons can come in to get access to our services there are a few other places that we would have decentralized our services to that still falls under our purview, such as like the West Demerara Regional Hospital in Region 3, the Diamond Diagnostic Center on the East Bank, and we have staff on the East Bank corridor. We have a counselor who is also placed at the Supply Health Center. As it is, we are also working hard to be able to fill other places to place counselors, that is, or if not a counselor, maybe a psychologist. In addition to that, at the mental health unit, we also have a service that the public is not so much aware of, but it is called the mental health website. It is a website that you can actually go online and access, and once you access the website, you will be able to speak to a counselor live online, right? However, needed for me to say that website service is only available for 8 hours during the regular working hours for now. But there are plans to extend that to a 24-hour service.
Good mental health is vital to our overall health and well-being. Could you tell us what is the situation here in Guyana? What are some of the cases we've been dealing with? What are the cases like?
Well, I can tell you, human beings in Guyana are like human beings everywhere else. And everywhere or anywhere that you find human beings, you're going to have people who will have different challenges, I would like to say. From one end to the other, and one extreme to the other extreme. But in Guyana, there are people who have mental health challenges. Very commonly, there are a lot of people who talk about stress and that they're always stressed or they feel stress. Of course, stress is something that a lot of people associate with the feelings, but it is a lot more than just a feeling, right? Time will not permit me to get into the other aspects of it. A lot of school-age children sometimes in Guyana, we have observed they have issues when it comes to self-harm, cutting and all of these sort of things, anxiety, panic attacks. A lot of people suffer from depression. So these are some of the common things that people suffer with or have challenges with in Guyana. And like I said, it's no different than any other part of the world. Once you have human beings and you're alive, you will have the challenge is when these things creep up on you in life, how do you handle it and how do you cope with it? For instance, your stress. Stress is always going to be present with us, right? It is how you handle the stress, how you cope with the stress, how you understand what stress really is. So those are the things that we need to know.
What strategies has the ministry implemented to address mental health issues and concerns among persons regionally?
The ministry has a national mental health strategy, a plan, right? That plan is in the process of being updated, which is going to be a plan for 2023-2030. And in that plan, I must say it's going to be a very comprehensive plan that is going to involve everyone across the country, every region, because we see mental health as a right of a service that everyone should be able to access everywhere. But we're still growing and we're still working in that direction, and with time we will get there. On the day per se, there's a lot of activity that the Ministry of Health would be rolling out, and we have different departments that would be throwing in their support. But on the 31st, which is the last day of this month, the mental health unit has an activity that where we're going to be engaging the public, and this is going to be on Main Street in Georgetown. At that, it's more or less like a health fair, a general health fair. We're going to have several different agencies that are part of the Ministry of Health, and even extended to other ministries as well, where people are going to be able to come and to access the services there. And the objective is to bring awareness as it relates to mental health to the general public, and let the public know that services are available, help and support is there, where you can find it, where you need to go, who you can call when you have any sort of mental health related challenges. So this is going to be on the 31st of October on Main Street in Georgetown, and the program is scheduled to commence, I think, at 9 in the morning, and this is going to run till around 2-3 o'clock in the afternoon. So I would like to take the opportunity to invite the public to come out and to see what will be happening on that day, ask questions, come very curious, and you'll be able to get a lot of information.
It's easy to forget about your mental health. So taking a break and prioritizing your mental well-being is crucial. When you're feeling stressed, anxious, or overwhelmed, yes, take a break or participate in an activity that will calm your mind or release some tension. Meditate, eat right, sleep in, exercise, or do something you enjoy with friends and family. Be bold and talk to someone you trust. With the proper support, you don't have to go through this alone. These activities significantly benefit your mental health and overall well-being and can reduce or prevent stress. Remember, you must prioritize your health and well-being. Caring for our minds is just as important as care for our bodies. Take that break, walk outside, breathe some fresh air, and come back feeling stronger or more refreshed. A message from the Ministry of Health.
The effects of the COVID-19 pandemic on the region of the Americas extend far beyond the lives lost to the disease. The care needs of most people in the region living with mental health and substance abuse conditions have remained unmet, especially those living in conditions of vulnerability, including historically discriminated populations such as Indigenous and Afro-descendant communities. PAHO's High-Level Commission on Mental Health and COVID-19 developed the new agenda for mental health in the Americas with 10 recommendations and strategy actions that are crafted for incorporation into countries' post-pandemic recovery strategies. 1. Elevate mental health at the national and supranational levels. Establish mental health as a national development priority, including mental health in universal health coverage, and develop strategic partnerships and alliances to advance and advocate for mental health at the national level and beyond. 2. Integrate mental health into all policies. Promotes the integration of mental health into all areas of health, as well as across sectors and in emergency and disaster responses. 3. Increase the quantity and improve the quality of financing for mental health. Outlines how to mobilize increased financing for mental health and allocate it more efficiently and equitably. 4. Ensure the human rights of people living with mental health conditions. Advocates for strengthening human rights for mental health through legislation and policy, transitioning services from psychiatric institutions to community-based care and capacity building in human rights across sectors. 5. Promote and protect mental health across the life course, including childhood and adolescence, adulthood, and older age. 6. Improve and expand community-based mental health services and care. Delineates actions to improve service coverage and quality by integrating mental health into primary health care, making services culturally competent, harnessing digital interventions, building capacity in mental health and psychosocial support, and empowering service users and their families. 7. Strengthen suicide prevention. Provides concrete guidance on evidence-based strategies to prevent suicide and its risk factors through the development of national suicide prevention strategies, public policy on means reduction and alcohol use, and capacity building to respond to self-harm and suicide. 8. Adopt a gender transformative approach to mental health. Lays out actions to reduce gender inequalities and address gender-based violence and harmful masculinities, key threats to mental health. 9. Address racism and racial discrimination as a key determinant of mental health. Emphasizes the need to combat systematic racism, targeting indigenous peoples, people of African descent, and other ethnic groups by working with these communities to understand racism and its potential solutions, establishing national action plans against racism and racial discrimination, strengthening policy and legislation, and creating anti-racist environments. 10. Improve mental health data and research. Proposes actions to improve the availability and quality of mental health data through the expansion of mental health data collection, data disaggregation, strengthen monitoring and evaluation, and research in priority areas of mental health. Let's work together to create a world where mental health is the top priority.
When we talk about one's mental health, what do we really mean? I know mental health is one of those topics that is very, very important, and we hear about it so many times. But for persons who are listening and viewing the program and are wondering, my mental health, what do they mean by this? Could you tell us what this mental health means?
A person's mental health speaks to their general emotional, psychological, and even physical well-being. The old phrase that we know, it says, there is absolutely no health without mental health. So you can be physically healthy, but mentally you're not healthy, you still have a problem, right? So mental health is imperatively important, and how a person's mental well-being affects them is how they're going to go through their life. Right? It would affect your decisions and choices you make in life, how you interact with people, how you're motivated, and all of these sort of things. So when we talk about that, having said that, it is important for the public to understand that if you feel that suddenly, or you notice that suddenly your level of motivation in what you have been doing has declined, you might be having some sort of challenge. You feel drained, you feel a lack of ableness. Question what's going on. Go see a professional, get some help. Stress, as I said, is something that a lot of people associate with a feeling, but it is a lot more than just a feeling. The question is, what is causing the feeling, right? And how is it affecting me otherwise than just me feeling sad, or me feeling down, or me feeling, pain and aches in certain parts of my body? What is actually causing it? And I want to appeal to the public: go and get some professional help if you notice this is happening to you.
How can we combat and prevent this stigma that is attached to mental health issues? This has been there for over many years, and I know that it will gradually go with time.
It will be removed with time. That's exactly, what will happen. public awareness on mental health is something that has been ongoing. Even as we speak, that's happening right now. We were trying to get the public to understand that if someone sees the need to go and get to see a psychologist or to see a counselor, it doesn't necessarily mean that you are, there is something happening with your insanity or your sanity, right? It could mean that you're feeling down. It could mean that you're having difficulty with a certain social related issue in your life, right? So there is a stigma and a perception that, hey, if I'm going to go see a psychologist or I'm going to go see a counselor, it means that there's something wrong with my sanity, right? And it is people who stigmatize mental health, and it comes from myth and misperception and misinformation, and we shouldn't allow that to continue. But I'm happy to say that gradually it seems to be dissipating and declining.
What can workplaces do to better facilitate good mental health practices among staff and workers?
It comes down to subordinates and superiors, and I think sometimes subordinate staff, sometimes in any setting, they feel that no one is giving them a listening ear. Their well-being is not being catered for. Sometimes and you said it well, an important aspect of mental health is being able to talk to somebody. And if you're working in a setting and you feel that there's nobody there for you to be able to talk to, that's going to have an effect on you in one way or the other. So persons need to make themselves available, right? HR departments in agencies and ministries and, even in the private sector. Make sure your HR staff are trained, to be able to interact with the public. A lot of times, HR departments are supposed to solve the problems, but they become the problem. Importantly also, ministries and agencies and companies should also try to allocate resources towards the capacity building of their staff and place some focus on their mental well-being. That's very, very important. Maybe do workshops, sponsor workshops, training for their staff. That helps, and you would be amazed how far that sort of thing goes.
Hi, I'm Katina. It's been quite a roller coaster for me for the past 6 months. I've experienced anxiety attacks, dealt with burnout, and even got diagnosed with hypertension. Talk about a handful, right? In addition to prescribing medication, my doctor emphasized the need for me to shake things up a bit and make some serious changes in my life. Life can get chaotic, and if you don't prioritize your physical and emotional well-being, you might end up in a situation like mine or even worse. Carving out time for yourself through activities like reading, meditating, exercising, sleeping more, trying new things, and eating healthier can lead to a happier and healthier life. Remember to schedule regular checkups with your healthcare provider. Annual exams, screenings, and preventative care can help detect and prevent health issues early on. Remember, your well-being matters. A message from the Ministry of Health.
Depression is the largest cause of disability worldwide. At worst, depression can lead to suicide. In humanitarian emergencies, 1 in 5 people are affected by depression and anxiety. Depression and anxiety lead to a global economic loss of $1 trillion per year. On average, just 3% of government health budgets is invested in mental health. Depression can be prevented and treated at relatively low cost. Treatment usually involves talking therapy or antidepressant medication, or both. If you think you have depression, talk to someone you trust. Seek professional help. Depression. Let's talk.
If the black dog of depression makes you feel like the saddest soul on earth, you're not alone. Around 350 million people share this debilitating but treatable condition. If you're worried about someone, ask if they're okay. If you're not doing so well yourself, ask for help. There is no shame in doing so. The only shame is missing out on life. So get help, be helped, and always hold on to hope.
What mental health conditions are more prevalent here in Guyana? What are the most common ones that we see on a day-to-day basis?
Everybody's stressed, right? That's the key one. 90% of people who will come will tell you about they're stressed. Some people will come in and just say, I'm depressed, right? And again, the reason for that is because people associate stress, depression, all these things with a feeling. It's based on how they feel. But the bigger question is, you need to ask is what is causing me to feel the way that I am feeling? And in addition to that, also to understand what's happening to you while you're feeling the way you're feeling. So stress, depression, anxiety, panic attacks, low self-esteem. People struggle with these sort of things in Guyana a lot. But of course, that doesn't go to say that there are other people who don't have other mental health challenges, from time to time. But those are the common ones. And at the mental health unit, we are ready, prepared, and always available to, be able to help with anyone who may have those sorts of challenges.
As we wrap up today's program, what advice do you have to our listening and viewing audience with regards to mental health well-being?
What I would like to say to people is, take stock of your mental health just as you would do your physical health. There are so many people who place a lot of emphasis and attention on their physical well-being, how I look, whether I'm gaining weight or not understanding that sometimes it's your mental health that's causing you to gain a lot of weight. Pay attention to your mental well-being. It's critically important. As I said earlier in the program, if you start to feel demotivated suddenly, you start to lose interest in certain things, ask yourself, why is this happening to me, right? And go out and get help. Or apart from going out and getting professional help, find somebody who you trust and you can talk to, you're comfortable with, right? It doesn't always have to be a professional. It can be somebody that you trust and you can confide in and somebody who wouldn't judge you or become critical of you. And do not allow yourself to get trapped by starting to engage in unhealthy coping mechanisms. Some people resort to alcohol and other substances just to be able to cope with their challenges. They're healthy and unhealthy coping mechanisms. Choose the right ones.
Thank you for joining me on the program today, Dr. Constantine, and I encourage you to keep up the good work that you've been doing at your unit. Thank you for joining us today on the program. I'm Alicia Martin saying goodbye for now.